Welcome to our sonography lecture on spleen pathology, part 7 of 7 malignant neoplasms for the sonographer. This lecture will cover lymphoma, hemangiosarcoma, and metastases. We're going to begin today with lymphoma. Now, lymphoma is a primary cancer of the lymph nodes, and because the spleen is so closely related to the lymph node or the reticular endothelial system, it is not uncommon to see lymphoma present in the spleen. There are two variants of lymphoma. There's Hodgkin and non-Hodgkin. The two types can only really be differentiated by taking a blood sample and evaluating it under the microscope. It's the presence of the Reed-Sternberg cells that is going to indicate Hodgkin lymphoma. There are some big differences between Hodgkin and non-Hodgkin in the way that it is cured and the way that it is managed. Hodgkin lymphoma is easier to treat, therefore really comes with a higher cure rate. Non-Hodgkin lymphoma is very difficult to manage and unfortunately is the more common form of lymphoma. As I mentioned, the spleen is compromised of a lot of lymphoid tissue, so the spleen is commonly involved then with lymphoma. Lymphoma then is the most common malignancy of the spleen because of this. On ultrasound, we're going to see diffuse splenomegaly, so the spleen is going to be very large, and there are going to be hypoechoic focal areas scattered throughout the spleen. Here is a very large spleen exhibiting lymphoma via the hypoechoic masses within. Another type of cancer that affects the spleen is hemangiosarcoma. Hemangiosarcomas are a form of malignant cancer that arise from the lining of blood vessels. Hemangiosarcomas really can arise anywhere. Anywhere that there's a blood vessel, the lining of it can develop cancer. However, the spleen is the most common location for hemangiosarcomas to develop. Secondary locations that it likes to develop are also in the lungs and the heart. On ultrasound then, we'll see a complex mass within the spleen. So here's an example of a hemangioma. We can see that it looks like it's full of septations, thick septations, kind of debris, very complex appearance to this mass. Our last disease then is metastases to the spleen. Metastases are cancers that usually originate in another organ and then develop in other organs as a secondary cancer or metastases. The spleen is the 10th most common organ to develop cancer from primary places such as breast, lung, or skin cancer, which is melanoma. Metastatic tumors are going to present in multiple ways. They can be seen as lesions with variable presentations in the spleen, or they can be microscopic, causing no symptoms, or we're not going to be able to see them on ultrasound anyway. Here are a couple presentations of metastases to the spleen. This example happens to be melanoma on the top. We can see that melanoma looks kind of similar to lymphoma, but it has brighter lesions compared to lymphoma's hypoechoic lesions. And we can see that they are typically going to have increased vascularity. They can present as cystic, and then we have a gross specimen of metastases within the spleen. And that brings us to the end of part 7 of 7 of splenic pathology. Please see other videos to review parts 1 through 6.